So we are going to talk about what an allied health assistant does. But first of all, meet Richard, our lovely skeleton that might join us in class, and we also use in our remedial massage class with our anatomy learning. So this kind of equipment is something that you'll see, especially if you work in a hospital environment. So an allied health assistant is basically that. It assists an allied health professional. So an allied health professional would be OT, speech physio, dietitian, psychologist, psychiatrist, also podiatrist, x-ray technician. So it's quite broad, and pharmacy. So it's quite broad, as you can see. So as an allied health assistant, it's your job to make the client appointments, make sure they've got follow-up, make sure all their records are up to date and organised. If you do sessions, so you might do some one-on-one sessions with them under any of those modalities. You might visit a school, you might visit a home, you might work in some group sessions along with the allied health professional. You must keep clinic records of those, proper anecdotal SOAP notes. They are a medical record. Any contact you have with a client, you will keep a record of in their client file also. You will collaborate and liaise with other health professionals regarding that person's health plan and help make appointments or send off referrals. So you do a lot of admin stuff. But then you also help with sessions or work one-on-one with clients. You might even be responsible for helping a client with, say, a hydrotherapy program or a fitness program. You might help with writing or speech, or it's really quite endless. Also, your job is to take care of the premises, of the venue. Make sure they're neat and tidy. Make sure resources are kept up to date. Make new resources. Replace old resources. So basically, you're going to become the mummy of that clinic. So whether that be a public enterprise like a hospital or an elderly home or a private enterprise that's funded like an NDIS provider or a private enterprise that's not funded, like a local OT or a local physio. So it's going to really, really vary, but the scope is endless. It can be a really exciting position to have. You learn so much. And in my time as an allied health professional, I got to do some amazing things. I was part of the development of all of our bump hubs here in Kalgoorlie, where the babies all get weighed and followed up with your child health nurses, and they also get regular checks with the OTs and especially the physios. We're also helped with instigating and starting our neonate support and also our early intervention support with our babies, our premature babies, all of those kinds of things. I've worked with adults and children, so you have a lot of variety, depends on where your preference is, and I've worked in multiple different places. So an allied health assistant, you really do get to do a bit of everything, but you need to be organised. You need to be reliable. You need to be 100% confidential. And you need to be able to take charge and actually organise things and, make the space where you work somewhere for you to be proud of, but also somewhere where all of the clients and the staff really want to be and feel very, very comfortable and be very, very efficient in your job.